today we're going somewhere pretty cool, but before we do that, we're going to nip up to the doctors in Praia de Luz. I wasn't going to film this because it's scary and personal and all those other things, but I am going to because it might inspire someone else in this position to go to the doctors, take it seriously. Someone else might not know about this because I didn't know about it until a few days ago, and so I think information is key in things like this, and it's probably nothing, but the fact that it could be something, I just can't get out of my mind. So basically, when we were in Scotland, I noticed a tiny black, like a small black bruise looking dot on my toenail, and you're probably thinking what? And I showed Chris and I was like, what's that black spot on my toenail? And Chris was like, it's probably just a bruise. And I remember thinking, but I've not hit my toenail at all. I don't remember like bashing my toe, stubbing my toe. I don't remember dropping anything on my toe. And so I can't see it. But saying that, we did the Lake District. We did lots of climbing and walking whilst we were in Scotland. We climbed up 2 ginormous mountains, and the first one wasn't done in the best footwear. I literally just wore my River Island boots, which were great for grip but not very good for like support and things, and I do remember my toes like aching when we did like a whole day hike. So I thought maybe it's due to that, like that's probably what it's going to be. And then I just kind of forgot about it. I was like, it'll go. I just forgot about it. And then about 10 days ago when we were here, I don't know why, but I just looked at it again when we were around the pool and I was like, does it look like it's changed to you? Because it's been like a month now, month and a half, and it's still there. Like, why would it still be there if it was a bruise? Why is it not faded type thing? And Chris was like, I don't know. And then I did the worst thing I could possibly have done. You guys all know what I did. You all know. I googled, and you should never Google most of the time, but in this case I was so ill informed.
You should never ever Dr. Google.
You shouldn't, I know you should, but we wouldn't have known. And what if it is something and we didn't Google and we just left it as a bruise for months and months and months and months? Chris is saying you still should never Dr. Google. I know it's bad, and I know 9 times out of 10 it's not what Dr. Google says it is, but in this case I didn't know this existed, and so if I didn't Google I wouldn't have known, and I probably would have been ignorant, and it could have been worse. Basically, I didn't know there's a form of skin cancer that presents itself in your toenail or your fingernails.
Extremely rare though.
It is extremely rare. It's very rare. It's mainly affected in over 50s. It's got nothing to do with UV sun like most skin cancers. It's a melanoma, which is the worst type of cancer. So I just don't think it's worth risking, guys. I just don't think it is. I know some people see these things and are like, oh my gosh, that's quite scary, I'm just going to ignore it. I'm not that person. I cannot relax knowing that I've got something that's probably nothing, but it could be something. Like I can't relax, especially as the key in survival for these types of things are quick diagnosis and treatment. And so I found this out a few days ago, and I kind of had a really horrible day thinking, oh my gosh, have I got skin cancer? You think the worst, don't you? You think about all the worst things you could possibly think about. And then the car broke, and so we couldn't get out to the doctors like I'd planned on. And now we've got the car back, and I'm like, oh, am I just overthinking this? But I can't. It is ruining my days. Every time I look at my feet, I get a sick feeling in my stomach, like, what if this is skin cancer? What if this is the melanoma? And I just can't relax. So it's probably nothing, but it might be something. I'll show you guys. Oh gosh, I can't even look at it without wanting to cry. I'll show you guys what it is in a moment. So I feel like before we go out today, I'm just going to go to the doctors. There's one in Praia de Luz, that Chris saw the other day, so I'm just going to pop in there with my mask. I'm going to ask if they can have a look at it, and if I can be seen. Fingers crossed it's nothing. If any of you guys have any experience of this, then comment down below and let me know. But I just think it looks evil, so let me show you guys. If you guys don't like toes, or you have a fear of toes, look away now. Okay, so there, that's it there. Let me see if I can zoom in a little bit. Can you see it there? Well, obviously you can see it. It's disgusting. It's got like a tiny black dot that I can see, and then it looks like blood around it. It's also started to bring the nail up a little bit. So basically that's it. From the research that I've done since finding it and Dr. Googling, the melanoma, it starts with an S, subbugal? There's a name for it starting with an S, melanoma S something. Usually presents itself as a streak down the nail, but it does also say that if you have a black spot on your toe, you should seek medical attention urgently. So that filled me with lots of positivity. Anyway, I'm just filming this so that you guys know if you've got a lump, a bump, if you've missed your smear test, if you've not had an eye appointment in many, many years, if your children have not had eye appointments in many, many years, if you've got any marks or moles or anything on your body that just doesn't quite look right, but you're not too sure if you should worry, but it might, go get checked, guys. It's literally not worth the risk. It's not worth it. It takes 2 minutes, maybe not 2 minutes, but it doesn't take much time out of your day, and it's so much better to be safe than sorry. Things like this are key in having an early prognosis. So we're gonna go to the doctors. Is everyone almost ready? Not key to having a prognosis, that's not the right word I was looking for. It's key to having a good chance of beating anything nasty, a better survival rate if you get your diagnosis earlier. That's what I meant. It's not worth sitting around and umming and ahhing and not too sure. It's best to just go and get checked. So that's what we're going to do. Is everybody ready? So we just got here. I've just run up this big hill. We just got here and I just went to the reception and I need to come back and get my mask. I forgot my mask. But she did speak to me. She said that the doctor can see me right now. They're a private doctor, so we have to pay for everything up front and then claim it back for our insurance. But I don't think the consultation's €60. Can't claim that back anyway. €60 for peace of mind. It's definitely worth it, hopefully. That's what I'm given. And if not, then at least we'll know. And it's always best to know in these situations. Just saw the nurse to have my blood pressure and temperature checked. All that looks good. Now I'm just waiting to go in and see the doctor. Well, that was not good news. Oh, I'm so nervous. So basically, the doctor said that in her experience, if it was a trauma, it would have grown out, the blood would have dispersed and it would have changed colour by now, as it's been like 2 months. And obviously it hasn't. So I've got to see a dermatologist. They got me an emergency appointment for tomorrow and I might need a biopsy. Oh, Chris is walking down. Okay guys, I've just sat down, I've just explained everything to Chris. I want to explain it to you guys before I get back to the car because I don't want the girls to hear and I don't want the girls to be worrying. So basically, I don't even know what I said. My mind was a bit blurry and I was walking up the hill. Basically, at first she thought I'd said that it happened 10 days ago. And she said, I'm pretty confident that this is a trauma. The toenail has slightly started lifting and she looked through like a little scope thing and she said, I think it's the black spot is caused by the toenail lifting. It looks like there's something in there. That's what she said. And so I got the impression that she thought some sort of fungal in my toenail has lifted it and then a piece of dirt's got in there and that's what's caused the black. Like an infection type thing. That's what I got the impression she thought it was. But I explained to her that can't be possible because the toenail actually only started lifting like yesterday. Or was it today? No, it was yesterday. The toenail only started lifting yesterday and I've had the black spot now for a while. And so she said quite confidently, I think it's trauma. And then she said, I can't remember, there was a passing comment about, really, do you not think after all this time it would have grown out? Or I said something like that. And she said, no, 10 days, you know, grown nail grows X amount and 10 days is not that long or something like that. And I was like, no, I haven't had it 10 days. I've had this like 2 months. And then her face changed and then mine did. My stomach dropped. And she said, oh, that changes things. You really need to see a dermatologist. Previous to that, she said, I think it's a trauma, but it's always best to steer on the safe side. And maybe next week or the week after, we could try and fit you in to see the dermatologist. And then all of a sudden, it was, you need to come back tomorrow urgently and see the dermatologist who might want to take a biopsy. If you do have to have a biopsy or she does think that a biopsy is necessary, then that needs to be done in hospital. It's not like putting a needle in and taking a bit out. It's more like a minor surgery. So now I'm absolutely papping my pants. I don't really know what else to say really. I feel relieved that I've gone and got checked out because, like I said before, things like this are not best left and I was worrying anyway, but obviously it's not the news I wanted to hear. So now I need to just process all that as best I can. Chris reacts way worse than I do in situations like this. He is like not good right now. And then we need to push it aside and carry on with the day for the girls. You need to push it aside. Carry on with the day for the girls. So that's the update, guys. Sorry I can't give you any more information. That's the update right now, and we've got a family, we've got young children, so we need to get on with the day and keep things okay for them, and that's what we're going to do. So see you in a little bit.
Did you know that the appearance of your nails can give you warning signs of potential underlying health issues? Here are some common nail conditions that could help you decipher what your body is telling you about your health.
Normal nails are usually pink in color with a shiny reflective luster. Changes in the nail colors can be associated with certain underlying health as well as nail or skin disorders. For example, yellow discoloration on the nails can be associated with underlying fungal infection on the nail or psoriasis. A green discoloration on the nails is usually caused by a bacterial infection in people with wet hands. Dark discoloration on the nail can be a cause of concern because it may be a sign of an underlying cancer of the nail unit. Changes in nail surface and texture can be telling. For example, dry cracked nails are commonly seen in people with wet hands. They can also occasionally be associated with underlying mineral or vitamin deficiency. Separation of the nail plate from the nail bed is also called onycholysis. This is usually due to trauma or manicuring, but it can also be caused by underlying health problems like thyroid disorders. Pitting of the nails is usually caused by trauma to the nail surface. However, it can also be caused by certain underlying skin conditions such as psoriasis or alopecia areata. Changes in the shape of the nails can also tell about the underlying state of health. For example, clubbing of the nails can frequently be associated with underlying heart or lung problems. It can also be associated with diseases of your gut. A concave spoon-shaped nail, also known as koilenikia, is frequently seen in young children. This is usually harmless. However, in older children and adults, koilenikia can be associated with severe deficiency of iron. Any recent change in the structure of the nail can be associated with an underlying cancer of the nail unit. Observe your nail for any changes. If you have any queries, please consult your doctor or dermatologist.
That's all, folks.